The fluorescent lights hummed their mechanical prayer as Hannah Clarke stepped into Cedar Creek Medical's pediatric ICU at 6:08 a.m., her hands already steady from muscle memory that predated this hospital by 17 years. She didn't tremble. She didn't hesitate. She moved through the corridors with the kind of efficiency that came from having triaged casualties in a sandstorm outside Lashkar, though no one here would ever know that. Her military records had been erased after Operation Sandcastle went sideways, and she'd been ordered to disappear into civilian life with nothing but a classified call sign and a folded flag hidden beneath her scrubs in locker 247. The smell of antiseptic cut sharp through recycled air as she pushed into the staff room, where 3 nurses were reviewing overnight charts with the glazed expressions of people who'd survived another shift without catastrophe. Hannah hung her jacket on the hook, the same one she'd worn for 8 years, unremarkable except for the faint burn mark on the sleeve from a medevac in Helmand Province that no one would ever think to ask about. She pulled her dark hair back with a practiced motion, the kind of economical movement that came from doing things the same way in a tent hospital, a Black Hawk's open door, a trauma bay at 2 a.m. Her badge clipped to her scrubs read Hannah Clarke, RN, Pediatric ICU. It did not read Captain. It did not mention Silver Star. It did not acknowledge the 12 wounded she'd stabilized under fire while coordinating air evacuation, or the 2 Medal of Valor nominations that had been quietly filed away in Pentagon archives under a classification level so high that even her own mother believed she'd simply taken a nursing job in Colorado and wanted to be left alone. The shift briefing came at 7 a.m. sharp. Dr. Marcus Mercer stood at the front of the conference room with the posture of a man who'd never doubted his own authority, his tie pressed to surgical precision, his fingers steepled in a gesture that said he already knew what everyone was about to tell him and would find their input insufficient. He was 53, Harvard Medical School class of 1994, chief of pediatrics for 9 years, and carried the kind of institutional power that came from having been born into the sort of family where medicine was a calling that paid dividends in social status. His eyes, pale gray, the color of winter rain, moved across the assembled staff with the measured dismissal of someone counting backward from a number he'd already decided on. When his gaze landed on Hannah, it slid past without catching, the way you might glance at a table setting and register its presence without bothering to remember it after you looked away. Room 407 was quiet except for the soft whisper of the ceiling fan when 7-year-old Lily Brennan arrived at 8:15 a.m., carried in by her father, Navy Captain James Brennan, whose dress blues hung in the car because he'd changed into jeans and a grey polo before driving from base. The girl was small for 7, maybe 42 pounds, with dark hair that had been braided that morning by hands that had stopped braiding hair yesterday around noon when the weakness started. Lily's mother had left them 3 years ago. It was just the 2 of them now, and Captain Brennan's face carried the particular exhaustion of a man who'd made peace with loneliness but couldn't make peace with his daughter not being whole. Hannah observed them from the nurse's station, the way she'd learned to observe, not staring, just noting the clinical details that spoke louder than vital signs. The girl's arms hung slightly slack at her sides. Her head tilted left, suggesting weakness in the right trapezius. Her eyes tracked her father's movements with the kind of anxiety that children develop when their bodies stop doing what they tell them to do. The first doctor arrived at 8:35 a.m., a pediatric neurologist named Dr. Chen with 15 years of experience and an air of someone who'd seen enough cases to believe there was nothing left to surprise him. He spent 20 minutes with Lily, ran a basic neurological exam, fingers to nose, toes to nose, grip strength bilaterally, found nothing definitive, and wrote possible conversion disorder in the chart before moving on to the next patient. His reasoning was sound, actually. Progressive weakness with no fever, no clear precipitant, no neurological deficits on formal testing. Psychosomatic made a kind of sense if you weren't looking at what Hannah was already seeing, the subtle paralysis creeping upward from Lily's lower extremities, the way her voice had grown quieter between 8 a.m. and 9 a.m., the barely perceptible change in her swallow reflex that would be invisible to someone performing a standard neurological exam in a 15-minute window. By 10:19 a.m., the second doctor had arrived, a pediatrician named Dr. Rothstein, younger, more urgent in his movements, more willing to order tests but equally convinced this was a case of parental anxiety manifesting as pediatric symptoms. He ordered blood work, CBC, CMP, tox screen, and wrote anxiety-induced motor symptoms, rule out Guillain-Barré, before leaving the room at 11:02 a.m. to attend to patients with what he considered actual medical problems. The thing about Guillain-Barré was that it usually presented with ascending paralysis, and while Lily's weakness was ascending, it lacked the sharp demarcation, the dramatic cascade of symptoms that made it obviously, clinically Guillain-Barré. It looked like something else if you weren't thinking about the right category of disease, which required you to think about tick exposure, about a specific type of paralysis that came not from nervous system inflammation but from a neurotoxin delivered by a small parasite, which required you to have treated it before, which required you to have worked in places where tick-borne paralysis was a thing you diagnosed on hunch and timing rather than textbook presentation. Hannah was in room 407 at 1:15 p.m. when the third doctor, a visiting pediatric infectious disease specialist named Dr. Lee, performed a cursory examination and concluded without much conviction that Lyme disease was unlikely given the timeline. The fourth doctor arrived at 3 p.m., a neurologist, Dr. Hassan, who ordered an MRI and spoke quietly to Captain Brennan about the possibility of a central nervous system lesion, his voice carrying the kind of measured professional doubt that meant he didn't believe it but had to rule it out. The fifth doctor came at 4:45 p.m., a generalist named Dr. Williamson who spent time in the room but no more than the others, whose contribution was to suggest they wait for imaging results before pursuing further investigation. The sixth doctor, Dr. Patricia Okonkwo, arrived during shift change and ordered a lumbar puncture to rule out meningitis, which Lily didn't have, which meant the spinal tap would be negative and would buy them time but not answers. It was during the sixth examination that Hannah made her move, approaching Captain Brennan in the hallway at 5:52 p.m. with the kind of deliberate calmness that came from having worked in combat triage where panic was a luxury reserved for people who had time for it. The captain looked at her, really looked at her, and she saw him register that she was asking for something, that her posture and eye contact were requesting permission to speak outside the normal hierarchy. She didn't mention her theory. She simply said, "Has she been outside in the last 14 days? Camping, yard work, hiking?" Her voice was quiet. Deferential. A nurse asking a question, not a captain asking an officer. She was still learning how to be invisible. Captain Brennan nodded slowly and said, "We were at Garden of the Gods last weekend." She was playing in the tall grass. Hannah's exhale was barely audible. "Thank you, sir." She did not say more. She did not say, "I think I know what this is," because that would have violated protocol, would have been overreach, would have marked her as someone who thought she knew medicine better than the 6 doctors who'd already evaluated this child. But she did walk directly to Lily's bedside at 6:08 p.m., when no doctors were present, and she performed a systematic skin examination using the kind of gentle thoroughness she'd learned in a forward surgical team outside FOB Shank, searching for something the size of a period at the end of a sentence, a small dark tick that would be easy to miss if you weren't thinking about it, if you weren't running through the differential of a 7-year-old with progressive ascending paralysis and a history of outdoor exposure. She found it at 6:14 p.m., embedded in the hair at the base of Lily's scalp, a wood tick engorged with blood, producing a neurotoxin that was paralyzing the girl from the bottom up, and the solution was simple: remove the tick, wait 72 hours maximum for the toxin to clear, watch the paralysis reverse as the neuromuscular function came back online. She documented her finding in the chart at 6:21 p.m. with a note flagged for physician review: embedded tick, occipital region, consistent with tick paralysis presentation. Recommend removal and monitoring. That wasn't an accusation. That was information. That was what nurses were supposed to do, observe the details that physicians in their time constraints sometimes missed. What happened next didn't happen immediately. It happened at 7 p.m., when the 7th doctor arrived for evening rounds, Dr. Marcus Mercer himself, Chief of Pediatrics, Protector of Physician Territory, who read Hannah's note at 7:04 p.m. while standing at the computer terminal. She watched him from across the unit, not staring, just the way she'd learned to watch things that mattered. His jaw tightened. His fingers stilled on the keyboard. He looked toward room 407, then back at the chart, then his eyes moved across the unit until they found her. The room went dead silent. Not literally silent, the ventilators wheezed their mechanical rhythm, the heart monitors beeped their steady electronic prayers, the fluorescent lights hummed their overhead prayer, but the social silence of a man whose authority had just been questioned by someone with no authority whatsoever. The silence lasted exactly 3 seconds. Then he stood, closed the chart, and began walking toward her, his footsteps sharp on the tile floor. 1, 2, 3, 4, his expression the kind of composed anger that meant he'd already decided what this conversation would be before it started. His footsteps stopped 3 feet from her. Hannah didn't move. Didn't look up from the patient chart in her hands, though her grip had tightened enough that her knuckles had gone pale as bone. Dr. Mercer's shadow fell across the page. "Your note." His voice carried the precise edge of someone accustomed to being obeyed. "About the tic paralysis." That was creative. Hannah turned the page, kept reading. Specific gravity of cerebrospinal fluid values, protein counts, nothing useful. Everything useless. "I'm going to make sure the entire department understands the difference between observation and diagnosis." He stepped closer. The antiseptic smell of his cologne mixed with something sharper, the ozone scent of a man already calculating trajectories. "My grand rounds begin in 40 minutes. You should attend. Educational opportunity for you." She closed the chart. Met his eyes. The kind of calm that comes from having already survived worse things than this, though he would never know it. "Whatever you need, doctor." His smile had the quality of a sword being drawn, slow, deliberate, showing the blade before it cut. "Good nurse. That's what I like to hear." 20 minutes later, Hannah stood in the tiered conference room at Cedar Creek Medical while 20 physicians settled into seats arranged like amphitheater rows. The projection screen glowed with Lily Brennan's case file, vital signs, test results, psychiatric notes from the consulting psychologist who'd written that stress from her father's naval deployment had manifested as conversion disorder. The words sat on that screen like accusations. Dr. Mercer stood at the podium with the composure of a man who'd never been questioned in his professional life. His pressed white coat, monogrammed cuffs, the subtle shine of his wedding band, all the infrastructure of certainty. He clicked to the next slide. Lily's photograph. A 7-year-old with Captain Brennan's dark eyes and the careful posture of a child learning to be small. "Progressive ascending paralysis," Mercer began, his voice carrying the rounded vowels of confidence. "Onset over 72 hours. No fever. No clear etiology. 7 physicians have now examined this patient. 7 different specialties. And yet," he paused for effect, "no organic pathology. The working diagnosis is psychological. Conversion disorder secondary to family stressor." A senior cardiologist nodded. A resident scribbled notes. The room had the texture of consensus hardening. Hannah stood against the back wall where the nurses always stood, not given chairs, positioned where she could observe but not participate. She watched Mercer's posture, the way his shoulders squared as he moved through the case. This was his domain. These were his rules. Then something moved in her peripheral vision. Lily's most recent scalp photograph, taken during the neurological exam, flashed on the screen for exactly 2 seconds before the next slide appeared. But Hannah had seen it. Had seen the small dark spot behind Lily's left ear, partially hidden by hairline, the way the skin around it was slightly inflamed. The tic had been there the whole time. Embedded. Feeding. Climbing up the nervous system like a spider ascending a wall. Hannah's hand rose. The room stilled. 20 pairs of eyes rotated toward the back of the room like searchlights finding a target. Dr. Mercer's jaw tightened so slightly that only someone trained to read micro-expressions would have noticed. Hannah had been trained to read a lot of things. "Yes, Nurse Clarke." His tone suggested he was granting an audience to a child, and a slow child at that. Her voice stayed level. No tremor, no hesitation. "Has anyone performed a complete scalp and skin examination for embedded tics? The progression matches tic paralysis. Ascending paralysis starts in the lower extremities, climbs toward respiratory muscles. The timeline matches perfectly." Silence bloomed like a bruise spreading beneath the skin. Then laughter. A senior internist first, a ripple that spread through the room like water finding channels. Mercer smiled, a smile that had the quality of a shark breaking the surface. "Ladies and gentlemen," he said, his voice carrying across the amphitheater with the ease of someone who'd practiced dominance, "this is what happens when we let nurses watch too much House. Dr. Google here thinks she's solved what 7 actual physicians couldn't." He held up his hands in mock surrender. "Tick paralysis. From the ICU. Where she bathes patients and changes bedpans. Next she'll tell us she's diagnosed a prion disease from patient hygiene." The laughter built. Not cruel exactly, worse than that. It was casual. The laughter of people who'd never had to question whether they belonged in the room. Hannah watched a resident laugh while looking at his lap, nervous energy that needed release. Watched a fellow nurse in the corner bite the inside of her cheek. One tear, just one, slipped down Hannah's left cheek. She didn't blink. Didn't look away. Just reached up with the index finger of her right hand and wiped it away while maintaining perfect eye contact with Dr. Mercer. The gesture had the quality of someone brushing away a raindrop. Insignificant. Unremarkable. Except her hands had held lives together in places where the rain fell sideways from artillery shells, and those hands remembered. Captain Brennan's daughter lay in a room 3 floors down, getting weaker by the hour while this room performed its rituals. The weight of it pressed against Hannah's ribs like a hand making a fist. "Captain Brennan's daughter is dying," Hannah said quietly, "while you perform." The room went so quiet you could hear the fluorescent lights hum, that high-frequency whine that most people's brains filtered out but that registered in the nervous system as persistent tension. Dr. Mercer's face flushed, color rising from his collar with the speed of humiliation finding a target it didn't expect. "Get out." His voice had dropped to something quieter and sharper. "Now. Out of my grand rounds." Hannah walked. One foot in front of the other, down the amphitheater steps, through the double doors, into the hallway where the rail work happened in the shadows. She didn't rush. Didn't slow down. Just moved with the terrifying fluid precision of someone who knew exactly where her feet needed to be. 30 minutes later, her hand shaking, actually shaking now, the trembling wasn't fear but restraint, the effort of keeping herself in one piece, Hannah stood at the vending machine on the 3rd floor. Fluorescent light spilled down like an interrogation. She inserted coins. Selected black coffee, no sugar. The machine hummed and delivered. Dr. Mercer's voice reached her before she could turn around. "The problem with modern nursing," he said to 3 residents clustered near the hallway entrance, speaking loudly enough that it carried 10 feet through the still air, "is they think a weekend course makes them doctors. Little Miss Tick Paralysis probably diagnosed it on WEBMD because her mother had a pinched nerve in 2003. The residents laughed nervously, the way young people laugh when the powerful person in the room has decided something is funny. One of them looked at Hannah. She didn't acknowledge him. Dr. Mercer stepped closer. Close enough that she could smell his aftershave again, expensive cologne trying to mask something underneath. Trying to smell like someone who'd never been uncertain. "Maybe security should escort you out before you hurt someone with your delusions of medical school, Nurse Clarke." Hannah turned to face him. Looked at his face, the structure of it, the softness around the eyes that came from never having had to see what she'd seen. And then she spoke, each word deliberate as a heartbeat, her voice quiet enough that only the residents in immediate proximity heard it. "I've treated more critical patients before breakfast than you'll see in your career." She walked past him with her coffee. Didn't wait for response. Didn't need one. The thing about having already survived the worst is that everything after that is just management. What happened next, Dr. Mercer didn't tell anyone about for several hours. He waited until his anger had calcified into something useful. Something that could be documented. Something that could be weaponized. That afternoon, in his office with the door closed and the blinds drawn, he opened his computer. His fingers moved across the keyboard with the precision of someone building a case. Incident report form for B. Patient, Lily Brennan. Incident date, 02 for 7 hours. Reporting physician, Dr. Raymond Mercer, Chief of Pediatrics. The words filled the screen. Nurse Hannah Clarke demonstrated inappropriate challenge to physician authority in educational setting. Suggested unqualified diagnosis in Grand Rounds Forum. Created hostile environment and undermined physician leadership in presence of medical students and residents. He attached the Grand Rounds attendance sheet. 19 witnesses. He cross-referenced Hospital Bylaw Section 4.7.3 on scope of practice for nursing staff. He crafted each sentence with the careful precision of someone who'd been building these paper trails for 15 years. Then he opened a second form. And a third. By midnight, he'd sent for incident reports to the nursing director, to HR, and to the chief medical officer. Each one cited specific hospital policies. Each one cross-referenced the others. By morning, he had constructed something that looked like pattern. By evening, it would look like liability. He leaned back in his chair, the leather creaking beneath his weight, and smiled to himself in the darkness of his office. There were rules about these things. Rules about scope of practice. Rules about who was allowed to speak in rounds. Rules about who belonged and who didn't. Hannah Clarke had forgotten those rules. He would remind her. 18 hours dissolved into the steady rhythm of the monitors, beep, 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 a metronome counting down something Hannah couldn't quite name. Lily Brennan's paralysis had stopped climbing yesterday morning, the doctors had said. Stabilized. Encouraging sign. But stability wasn't improvement, and Hannah watched from the hallway nursing station as the little girl's oxygen saturation numbers told a different story. The weakness hadn't retreated. It had simply stopped advancing before it killed her. That wasn't recovery. That was a clock ticking backward on borrowed time. The girl's respirations had dropped from 22 breaths per minute to 16. 16 meant her diaphragm was working harder to pull air through her lungs. 16 meant the paralysis was creeping downward, muscle by muscle, toward her chest. Hannah had seen it twice in the field, once in Jalabad, once outside Sanjan Valley in Helmand Province, and both times the window for intervention was measured in hours, not days. She pulled up Lily's chart on her phone, the access she still had from before the reassignment, and scrolled through the vitals. The hospitalist had noted nothing. The overnight resident had written stable, no acute change. 7 doctors examining the same patient, and 6 of them had stopped looking because one of them had been wrong. The problem with being right when everyone else was wrong wasn't vindication. It was responsibility that settled like concrete in your chest. At 2:33 a.m., Captain James Brennan found Hannah restocking supplies on the adult oncology floor, 3 stories above where his daughter slept with tubes in her arms and a mystery in her veins. He was still in his dress uniform, navy blues with the insignia of a man who commanded carriers, though right now he looked like something smaller, something diminished by helplessness. His face carried the texture of a parent who hadn't slept in 40 hours and couldn't afford to stop watching. "Nurse Clarke," he said. Not a question. He'd learned her name from somewhere, Lily, probably, whispering between moments of fear. "I'm requesting that you return to my daughter's room for her care." Hannah turned from the supply cart, met his eyes. She didn't flinch at the captain star on his collar, didn't adjust her posture. "Sir, I've been reassigned." "I'm aware." His voice carried the resonance of someone accustomed to compliance. "I'm requesting an exception. My daughter asks for you. The other nurses don't understand what's happening. You do. And I need her to have the person who knows." That was when Dr. Mercer emerged from the medication room, tablet in hand, his expression arranged into something that resembled concern but smelled like strategy. He moved between the captain and Hannah with the fluid precision of a man protecting his territory. "Captain Brennan." Mercer's voice had changed texture, respectful, careful, the tone reserved for people who commanded respect. "I appreciate your confidence in our staff, but Nurse Clarke is currently under an ongoing personnel review. I can't in good conscience reassign her to pediatric care while that process is underway. Hospital policy requires." "I don't care about policy," Captain Brennan said quietly. "I care about my daughter." Which is exactly why I'm protecting her from scope violations, Mercer replied. His eyes found Hannah's for exactly half a second, a flicker of acknowledgement, a message, you see what happens when you push. Nurse Clarke performed an invasive procedure on your daughter without physician supervision. It's been reported to the ethics board. Until that review concludes, she cannot provide direct care on the pediatric unit. Hannah watched Captain Brennan's jaw tighten. She watched him calculate whether he had the authority to override hospital protocol, whether his rank translated into civilian healthcare systems, whether his daughter's life was worth the political cost. She watched him realize he didn't, and saw the moment that realization gutted him. When will the review be complete? The captain asked. These things take time, Mercer said. 7 to 10 business days, typically. She'll be restricted to adult medicine until then. Mercer didn't stay to see Captain Brennan's shoulders collapse. He turned back toward the medication room, and Hannah caught the slight upturn at the corner of his mouth, the expression of a man who had just taken a queen off the board while maintaining perfect courtesy. He had weaponized policy the way other men wielded knives. And he'd done it in front of someone with the rank to actually force the hospital's hand, which made it beautiful in a way that made Hannah's throat close. She stood motionless until Captain Brennan retreated to the stairwell, his hand gripping the railing like it was the only thing keeping him vertical. Then she returned to restocking supplies, 3 bottles of saline solution, 4 packages of sterile gauze, 6 ampules of medication whose names she read without processing. The fluorescent light above her head cast everything in that particular hospital white that drained color from skin and meaning from words. By 3:15 a.m., Dr. Mercer was in his office. Hannah knew this because she heard the security camera log him in, the soft electronic chirp that meant badge access, heard his office door close with the kind of deliberate quiet that preceded something important. She was pushing a medication cart past the administrative wing on her assigned floor when she saw his office light glow beneath the door, watched it illuminate for the next 4 hours while Lily's oxygen saturation continued its slow descent. She didn't have to guess what he was doing. She knew exactly what he was doing because she'd seen the tactic before in military administrative proceedings, the meticulous construction of a paper fortress designed to be bulletproof. He would be documenting every incident, every rule violation, every moment of insubordination, real or manufactured. At 4:42 a.m., the hospital's internal email system pinged. Hannah wouldn't see it until later when she pulled her personal email on her phone during a break, but the message would be there in the record, a strategic masterpiece of institutional language. Dr. Mercer to the hospital administrator, CC'd to the chief of nursing, the Department of Human Resources, and the ethics board coordinator. Subject line, incident report, scope of practice violation, pediatric ICU, shift 11/14. The email detailed every action Hannah had taken. But it reframed everything. The emergency needle decompression became performance of a physician-level procedure. Her decision to act became failure to wait for physician evaluation. Her knowledge of tick paralysis became overreach beyond nursing scope. And beneath all of it, the subtext, this was dangerous. This was a liability. This was a woman practicing medicine without a license, putting patients at risk, and the hospital needed to protect itself. By 5:18 a.m., a second report materialized in the system. This one invoked the Revised Code of Washington, Chapter 18.79, the Nursing Practice Act. Mercer had highlighted the relevant sections in electronic yellow. Nurse must not diagnose. Nurse must not prescribe treatment. Nurse must not perform procedures outside established protocol. He had built a cage of regulations and locked Hannah inside it. A third report followed at 6:04 a.m. This one was titled Pattern of Insubordination and Dangerous Independent Judgment. Mercer documented her suggestion about the tick paralysis, the note in the chart, the verbal discussion, and characterized it as a pattern of behavior, a nurse who believed she knew better than physicians, who acted on those beliefs despite her lack of medical training, who represented a systemic danger to patient safety through her arrogance. By 7:11 a.m., Dr. Mercer had composed a fourth incident report, this one describing the needle decompression in the most clinical terms possible, as though she had opened up a patient's chest cavity with a chainsaw instead of inserting a needle into the space between ribs. He included the standard of care literature. He included the hospital's guidelines. He included every possible argument that could be mounted by an attorney defending the hospital against a malpractice suit. The fifth report was scheduled for 8:02 a.m. It would contain a recommendation that Hannah Clarke be suspended pending investigation, that her access to all pediatric units be revoked immediately, that her nursing license be reported to the Washington State Department of Health for review. It would suggest that her actions constituted a breach of the professional standard expected of registered nurses in the state of Washington. And at 9:15 a.m., Dr. Mercer would send a final email to the board with the subject line, Urgent, recommend immediate personnel action, containing a summary of all 5 reports, a recommendation for her termination, and a note that he was available for any questions about the serious concerns he had regarding her fitness for practice. He did all of this alone in his office, the door closed, his fingers moving across the keyboard with the precision of someone dismantling a bomb, except he was building one instead. 3 hours of work. Strategic, measured, and absolutely devastating. Meanwhile, on the pediatric floor, Lily Brennan's respiratory rate dropped to 14 breaths per minute. The monitors recorded it. The night nurse documented it. Dr. Mercer's replacement, the overnight attending, made a note about continued clinical stabilization and wrote orders for continued observation. 7 doctors had now examined this child. None of them saw what was coming. The hiss of the ventilator in room 407 whistled its mechanical rhythm into the dark, and Captain Brennan, who had commanded thousands of sailors across 5 continents, sat beside his daughter and held her hand and had no idea that the nurse who understood what was happening to his child had just been quietly erased from her care. That wasn't the worst part. The worst part was that Hannah was already planning for this. She was already running scenarios. Already calculating what she would do when the opportunity came to help again, when the hospital's protocols became an obstacle rather than a boundary. Already understanding, in the quiet part of her mind that never truly left Helmand Province, that some rules were written by people who had never watched a child die from something preventable. And that sometimes the only thing between a child and death was a person willing to break those rules. She was a nurse. She followed protocol. But she had been Captain Hannah Clarke long before she'd ever worn the Cedar Creek Medical ID badge. And Captain Clarke knew something the 7 doctors didn't. Sometimes the only way to save a life was to stop asking for permission. What they didn't know, what Dr. Mercer didn't know, was that he was building his termination case on the exact moment she stopped restraining herself. He was documenting the moment she chose Lily over protocol. And in documenting it, he was documenting the precise evidence of who she actually was. The question wasn't whether he would fire her. The question was whether he would live long enough to regret it. At 11:00 p.m., Hannah's phone vibrated against the granite counter of her apartment kitchen. Text from an ICU nurse she'd never met, someone from the night shift, Lily coding. She moved. Not rushed, efficient. Jacket, keys, car door. The parking garage amplified her footsteps like a metronome counting down. Cedar Creek Medical was 7 minutes away at highway speed. She made it in 5. The pediatric ICU doors were locked after hours. Motion sensors. Badge readers. Hannah swiped her credentials at the glass. The green light blinked red. Rejected. She tried again. Same result. Behind the doors, she could hear the screaming of monitors, the percussion of adult voices calling orders, the sound of a child's body shutting down in real time. She waited. 30 seconds. 40. Her jaw clenched like a fist, but she didn't move toward security, didn't call out. Instead, she watched the hallway through the reinforced glass, tracking silhouettes, counting staff positions, assessing angles. Muscle memory from a different life. Mission planning. Route recognition. Captain Brennan appeared on the other side of the glass doors, still in his Navy dress uniform, still carrying the weight of command even in civilian space. His eyes found hers. He didn't hesitate. He pushed through the doors from inside, holding one open for her, and in that gesture was a question, "Do you know what she needs?" "Tension pneumothorax," Hannah said, moving past him. "Distended neck veins. Absent breath sounds. She's collapsed a lung." Brennan followed her into the ICU. The pediatric unit smelled like antiseptic and desperation, that particular chemical cocktail that precedes either miracles or body bags. Lily was on the bed, her small frame rigid, monitors screaming a discordant symphony of failing systems. 2 residents flanked her, one bagging oxygen into her lungs, the other calling for equipment that wouldn't arrive in time. The night charge nurse looked up, recognized Hannah, gave a single nod that said everything about which side of this war she'd chosen. Hannah moved to the bedside with the terrifying fluid precision of someone who had done this before in worse conditions. She didn't ask permission. Didn't apologize. She performed a systematic examination, palpated the trachea, felt for the deviation that meant pressure had shifted everything in that small chest cavity. Found it. Subcutaneous emphysema under her fingertips like bubble wrap under skin. 14-gauge angiocath. Now. Her voice didn't rise. That was the thing about combat, volume never mattered. Conviction did. The charge nurse handed her the needle. Hannah prepped the site, second intercostal space, mid-clavicular line, the anatomical landmark burned into her memory from 100 field surgeries. From Sanjin Valley where she'd taught a Marine named Rodriguez how to breathe between rounds. From FOB Shank where a medevac helicopter had been 3 hours away and a kid with a sucking chest wound couldn't wait. She drove the needle through skin and fascia until it hit the pleural space. The hiss of pressurized air escaping. That sound. She would hear it forever. Lily's oxygen saturation climbed. 68, 71. 75, the seizure stopped. Her small body went slack against the mattress, not from death but from relief, the pressure finally released, the lung re-expanding, the machinery of her nervous system no longer drowning in the consequences of a single engorged tick. Hannah withdrew the needle and secured it with a single piece of tape. Smooth. Economical. A procedure she'd executed in a sandstorm outside Lashkar with mortars walking closer and a Marine whose name she never learned bleeding out on a stretcher made of cargo netting and prayer. Lily's eyes fluttered open. Captain Brennan's knees buckled. He caught himself against the bed rail, staring at the specimen cup the charge nurse had already placed on the bedside table, the grey, swollen tick that had nearly killed his daughter. Then he looked at Hannah. "You knew," he said. "The first day. You knew." "Yes." He nodded once, slowly, like someone recovering from a blow. Dr. Mercer arrived at 11:40 p.m. The charge nurse had called him. Protocol. Courtesy. The mistake that would define the next 12 hours. He saw everything at once, Hannah at Lily's bedside, the specimen cup, the stable monitor readings, the child breathing steadily. Saw his case against her. Saw it still salvageable if he moved fast enough, if he documented correctly, if he filed reports before anyone could argue the clinical reality of what had just happened in this room. He pulled her into the hallway. The fluorescent lights cast everything in that institutional green that made corpses look alive and the living look half dead. "You were banned from this unit. You violated a direct order." Hannah's composure was absolute. She would have died. "You're terminated. Effective immediately. Security will escort you out." He was already typing on his phone, already moving through a mental checklist of incident reports, already building the narrative that would insulate him from questions about why he'd missed the diagnosis, why he'd resisted her input, why the chief of pediatrics at Cedar Creek Medical had nearly allowed a child to die rather than admit error. By morning, Hannah's badge was deactivated. The security system no longer recognized her. She emptied her locker into a cardboard box with the efficiency of someone who had packed for deployment a dozen times, scrubs folded into thirds, a coffee mug from a gift exchange, a photograph of Matthew at graduation. And the folded flag. The one that had come from an officer's funeral in 2015, handed to her by a chaplain who didn't know she'd been there when the patient died, that she'd held the kid's hand while his blood pressure bottomed out in a tent that smelled like diesel and death. She carried the box to her car at 6 a.m. Mercer watched from his office window on the 3rd floor. She felt his gaze like a scope sight, but she didn't look up. Her spine stayed straight. Her hands didn't shake. The box stayed level. She loaded it into her car, closed the trunk, and drove away from Cedar Creek Medical without ever checking her mirror. At 3 a.m., in an all-night diner on the eastern edge of Colorado Springs where the city wore out and the prairie began, Hannah sat in a booth with cracked vinyl and the kind of fluorescent lighting that drained color from everything. Her coffee had gone cold 40 minutes ago. The waitress had refilled it twice. Hannah hadn't noticed. She stared at her reflection in the dark window, a woman who looked like a nurse, sounded like a nurse, moved like a nurse. Who had disappeared once already into civilian clothes and small miracles, and the weight of pretending that her hands had never held an arterial clamp, had never tied a tourniquet in the dark, had never saved lives in conditions where the margin between success and failure measured in seconds. She wondered if it had been worth it. Disappearing. The classified operation that had ended with 7 casualties and 1 commendation she couldn't display. The order to vanish into the medical system as someone unnamed, undecorated, unseen. The deliberate erasure of Captain Hannah Clarke so that Operation Sandcastle could stay buried in the right classified folders in the right Pentagon basements. 1 life saved. 7 doctors corrected. 1 job lost. She pressed her palm flat against the cold window and watched her reflection do the same. The question wasn't whether she'd made the right choice. The question was what happened next. And at 3:17 a.m. in a diner on the edge of a city that didn't know her name, she couldn't yet imagine that the answer would arrive at Cedar Creek Medical in less than 24 hours in the form of her own son, a shadow box of medals, and a 2-star general in dress blues who would salute the very honors she'd been ordered to forget she'd earned. But that wasn't the worst part. The worst part was still coming. Matthew burst through the hospital board meeting's oak double doors at 2:17 p.m., breathless, 17 years old and carrying a shadow box that caught the fluorescent light like a weapon. The board members looked up from their agendas. Hannah's ex-husband had texted her an hour ago. Their son was coming to Cedar Creek Medical. She hadn't asked why. She'd learned long ago not to ask questions about the things Matthew did. He crossed the mahogany table without waiting for invitation, his jacket soaked from the Colorado Springs rain outside, and placed the shadow box in front of the board chairman with the precision of someone laying down a gauntlet. Inside, under museum-quality glass, medals caught light like small suns arranged in ascending order of gravity. The room's air pressure changed. Nobody breathed. "That's my mom," Matthew said, his voice steady as a sniper's exhale. "And you're about to fire someone you don't understand." The CEO shifted. "Young man, this is a closed board meeting." "How did you?" "She kept them hidden in the attic for 8 years. Matthew pointed at the shadow box without touching it. "Because she was ordered to disappear. Because when you serve in classified operations, you don't get to talk about them. You don't get to tell your son why you have nightmares. You don't get to explain scars. You just show up to work as a nurse and let doctors like Dr. Mercer treat you like you're stupid." The board chairman leaned forward. "What are these medals?" Matthew opened the shadow box. The movement was ceremonial, practiced. He'd been holding this moment for 3 hours, rehearsing in his car in the hospital parking lot. Bronze star with Valor. Silver star. 2 purple hearts arranged like parentheses around a purple heart from a second tour. Every metal piece was real. Every ribbon was faded from years of storage, and that fading was more authentic than anything these board members had ever touched. "She's Captain Hannah Clarke," Matthew said. "Not just a nurse. A combat medical officer. 12 years active duty. 3 tours in Helmand Province. 2 purple hearts mean she was wounded twice and kept working. The silver star means she treated 12 wounded under fire while coordinating air evacuation during Operation Sandcastle. The bronze star with Valor means..." The conference room door opened. Captain James Brennan stepped inside, still in his Navy service dress blues, the uniform somehow more real than the mahogany and leather around him. His eyes found Hannah standing in the corner where she'd been observing, and he approached her with the gait of a man who'd walked through sandstorms and come out the other side still standing. He leaned close enough that only she could hear, his voice like a radio signal cutting through static. Nightingale 6. 2 words. They contained 8 years of operation files, mission photos, classified briefing documents, and a death certificate for a corpsman named Miguel Rodriguez who died under her hands in a forward operating base during a mortar attack that she'd never mentioned to another living person. Hannah's mask didn't shift. Her composure held like reinforced concrete. But her hand moved to the flag pin on her scrub pocket, the only visible marker of her past, a small fold of fabric that looked like nothing to anyone who didn't know what it meant. "Captain Brennan," she said quietly. "How's Lily?" "Alive because of you," he said. Then he turned toward the board. "That's not just a nurse. That's the officer who coordinated my daughter's care with the same precision she used coordinating air evacuation for wounded Marines in the Sanjin Valley." The hospital CEO stood. Before he could speak, the conference room doors burst open again, and a 2-star general in dress uniform walked through with the kind of presence that made junior officers straighten involuntarily. General Patricia Holloway. Hannah recognized her immediately. They'd never met in person, but Holloway's name was on Hannah's Silver Star citation. The general who'd made the recommendation that Hannah be given the medal at all, and who'd then been ordered to help erase her from service records as part of her transition to civilian disappearance. General Holloway approached Matthew, took the shadow box from his trembling hands with ceremony, and began reading aloud. Her voice was the kind that carried weight, the sound of someone accustomed to being obeyed. Bronze Star with Valor. Citation for heroic service in combat. Recipient rendered emergency medical care under sustained enemy fire, maintaining continuity of treatment through 2 mortar attacks and 1 IED explosion, resulting in the stabilization of 8 critical casualties. The general paused, letting that land. Silver Star. Citation for gallantry in action. While enemy fire intensified, recipient continued treatment of 12 wounded personnel while simultaneously coordinating 3 helicopter extractions with forward operating base command, demonstrating medical expertise and tactical awareness under conditions that would have broken most personnel. The general's hand moved to salute, a crisp military gesture executed before the Bronze Star with Valor in Matthew's shaking hands, and the entire room understood this wasn't a civilian ceremony. This was a military honor being rendered in front of witnesses, and it meant something that transcended hospital politics. Then the doors opened a 3rd time, and 2 people in dark suits with the bearing of federal agents walked into the room with the kind of authority that made the hospital CEO visibly pale. Behind them came a 3rd agent carrying a tablet. The lead agent approached Dr. Mercer, who'd been sitting silently in the back corner, his face the color of old newspaper. "Dr. Mercer," the agent said, "our forensic analysis of Cedar Creek Medical's personnel database shows you accessed Captain Hannah Clarke's file 17 times over 2 days. Forensic timestamps show you created falsified entries indicating she fabricated her nursing credentials. We have your written notes in the system. Quote, create paper trail showing credential fraud, justifies termination, eliminates lawsuit risk. You documented your own conspiracy." Dr. Mercer's jaw clenched. I was protecting patient safety." "You were protecting your ego," the 2nd agent said flatly. A nurse with more combat medical experience than anyone in this hospital recognized a diagnosis all 7 physicians missed. That diagnosis was correct. And you attempted to erase her rather than accept it. The room erupted. Board members talked over each other. The hospital CEO's face turned the color of raw meat. And Dr. Mercer shoved back from his chair with enough force to knock it backward, the crash echoing through the conference room like a gunshot. "She violated protocol." His voice rose, climbing toward panic. "She practiced medicine without a license." 7 physicians examined that patient, Anne. Captain Brennan stepped forward. His Navy uniform was visible now, the weight of command authority making the room compress around him. And 7 physicians were wrong. And 1 combat medical officer with more field experience than everyone in this room combined saved my daughter's life. Twice. Once with a diagnosis you mocked. Once with a procedure you called beyond her scope. General Holloway added quietly, Captain Clarke has treated more critical trauma than most emergency physicians see in an entire career. Her judgment under fire is flawless. Dr. Mercer looked around the room, watching his support dissolve like paper in water. The board chairman wouldn't meet his eyes. The other physicians looked away. The charge nurse, who'd filed reports under his direction, had her back turned deliberately. His voice cracked. This is a witch hunt. I followed hospital policy. I protected our institution from. The lead FBI agent produced handcuffs with the soft metallic whisper of a door closing on someone's career. Dr. Mercer, you're under arrest for falsifying federal documents and attempted fraud. You have the right to remain silent. Anything you say can and will be used against you in a court of law. They walked him out through the administrative hallway, his protests echoing off the polished tile. Past the vending machine where he'd mocked her 3 days ago. Past the staff who lined the corridor in absolute silence, and Hannah understood that word had spread, that Cedar Creek Medical's nurses knew what had just happened, and that Mercer had become a cautionary tale in less than 5 minutes. By evening, the hospital CEO had personally called Hannah's apartment. She didn't answer. Instead, she drove directly to Cedar Creek Medical and climbed the stairs to the pediatric ICU. Lily Brennan's room was on the 4th floor, corner unit, window facing east toward the mountains that turned purple as the sun dropped. Hannah stood in the doorway. The little girl was awake, color returned to her small face, the paralysis already resolving now that the tick had been removed and its toxin was clearing her bloodstream. Captain Brennan was sitting beside the bed, holding his daughter's hand, and when he looked up and saw Hannah, he stood slowly and rendered a formal military salute, chest to fist, the kind of salute you give to a superior officer. Hannah returned it instinctively, muscle memory taking over. The movement was precise, official, witnessed by his daughter. I didn't know Nightingale 6 was here, Captain Brennan said quietly. In Colorado Springs. Saving my daughter. Hannah's voice came out steady. I didn't know you were the Captain Brennan from 2nd Battalion. They stood in the silence of shared recognition, 2 combat veterans in a pediatric ICU, a space that suddenly felt sacred because of who occupied it. Lily whispered, Daddy, why are you saluting the nurse? Brennan knelt beside his daughter's bed. Because she's a hero, sweetheart. She saved a lot of people before she saved you. Hannah turned and looked at the windowsill. On it sat a folded flag, the one she'd kept hidden in her locker for 8 years, the one that had belonged to Miguel Rodriguez, the corpsman who died in her arms during that mortar attack in Helmand Province. Somehow, between the board meeting and now, someone had placed it there. Matthew, probably. Or Captain Brennan. It wasn't hidden anymore. For the first time since returning from Helmand Province, Hannah allowed herself to be seen, not as a ghost, not as a nurse disguised as a civilian, but as exactly who she'd always been. The ones who have seen the worst often give the most. Lily reached out and took Hannah's hand, and Hannah didn't pull away. If you've ever been underestimated by someone who didn't know your true value, subscribe and like this video. And tell us in the comments, have you ever had to disappear to survive, only to discover that the truth was waiting to set you free?